Hi guys, welcome back to my channel. It's Dr. Shah and I'm a rural family medicine resident and I make videos on medical education and lifestyles of being a rural family medicine resident. Alright, so let's just get right into it. Today we're going to be talking about how do you check your blood pressure at home. In another video, we kind of talked briefly about what high blood pressure is and what does that look like and what are some risk factors. So in this video, we're going to be talking about how do you accurately check your blood pressure at home. So just a disclaimer, this is not medical advice. This is purely for medical education purposes only. If you have any questions, please ask your doctor and just make an appointment because it really varies. Not medical advice, just medical education. So let's just get right into it. A lot of times, if your blood pressure is elevated in the clinic, your doctor might tell you that you need to keep a blood pressure log at home. So what does that really mean? It's really important to take it correctly because it can lead to inaccurate values. And I always go through this with my patients just to make sure that they're taking it and logging it correctly. Here's the reasons why I would want some of my patients to check their blood pressure. One being that I want to make sure that my patient's blood pressure is actually elevated at home and not just in the clinic, because sometimes you can have blood pressure that's just elevated at the doctor's office. That's known as white coat hypertension. So we want to check to see, do you actually have it at home or is it only when you come into the clinic? So that's why I'd ask you to keep a log at home and measure your blood pressure. The other reason is you might be asked to keep a log because you may have started on some new medicine and want to know, are these medicines working? That's another reason. So you want to log and make sure that the medications are actually working before we make any additional medication changes. And the other thing is, do you have any changes in your blood pressure? Are they going up? Is it going down? Like, what's going on with it? That's a great way to know, is just keeping a log. And also just generally people that are more aware, that have more knowledge regarding blood pressure monitoring and how to check it correctly, they're usually better at being able to keep their blood pressure under control, which is, obviously great for all the reasons I discussed in the previous video. All right, so let's just get right into it. Okay, so how do I check my blood pressure at home? So what you want to do is that when it's time to check your blood pressure, you want to go to the bathroom. Having a full bladder may temporarily increase your blood pressure and it can make your results slightly inaccurate. So make sure you go to the bathroom. Then the next thing you want to do is sit in a chair. Sit in a chair with a back support and lay your feet firmly on the ground, both feet on the ground, okay? So that the heels are all touching on the ground. And just try to breathe normally as much as possible and stay calm. So you want to just not be talking, both feet on the ground, and just breathing. Okay, and then you attach the cuff to your arm, okay, and put the cuff directly on your skin, all right? Keep it directly on the skin. You don't want to do it above on the clothing. Keep it actually touching the skin. And it should be tight enough that it's not going to slip off, but not tight enough that you're like, oh my God, my arms are fall off. Not uncomfortably tight, but just tight enough that it'll stay on. And then you want to just sit for 3 to 5 minutes and just relax. All right, and just relax with the cuff on. Then you want to follow the directions that came with your cuff because each cuff may be a little bit different, just very slightly. So just follow the directions that came with it. Sometimes this could be there's a bulb at the end of the tube and you just have to press it to inflate the cuff. So you got to fill up the cuff with air, or other times in other monitors, you just like press the button and it just like squeezes on your arm and starts to fill the cuff up with air, okay? So it really depends on your cuff. But generally, that's usually where it does. One way or another, you have the cuff on, it starts to inflate, okay? And squeezing down on your arm. It really shouldn't hurt. And then after a certain point, you'll start to notice that it starts to deflate, all right? After that, you should see on the monitor, it will say the numbers, okay? The top number is the systolic and the bottom is the diastolic, all right? So after that happens, you want to sit for another minute and just relax and then measure your blood pressure again. So you want to do this 2 times back to back because you want to make sure that it's accurate. And the best way to do it is just to do it twice back to back and then take the average of those 2 numbers. That's the most accurate way of getting your blood pressure. The other thing is, how often do you need to check your blood pressure? So this really varies because every person may have a different schedule and it really depends on your personal situation, and you may want to talk to your doctor or nurse about it and they'll tell you how often you need to check your blood pressure. And some people may need to check it twice a day, once in the morning, once in the evening. So it really varies, okay? So what happens is, after you make a log of all your blood pressure readings for the week or 2 weeks or however long your physician has told you to do so, after that, they will take a look at your blood pressure log and see what's generally the trend. and see if there's anything related to the spikes or to the dips in blood pressure. So that's generally just a brief little overview on how to correctly measure your blood pressure at home. So I hope that was helpful and that you guys liked it. All right, bye.